Welcome, everybody. All right, welcome, everybody. We're going to give it a few more seconds. For those of you utilizing CART, I'm going to put the link in the chat. Okay. Thank you, everybody, for joining us today. I'm Bonnie Lynn Sweenor. I am a white woman with shoulder-length blonde hair, middle-aged, sitting in my office in Baltimore at Johns Hopkins. And I am so thrilled for this discussion today and for you all joining us. So I first want to reiterate that we have CART captioning services available. I'm just going to ask for that link to be added one more time to the chat, and an ASL interpreter joining us. So thanks both to the interpreter and the captioner. So this is the first of our second year of seminar series for the Disability and Public Health session. We are really honored and lucky to be speaking with Dr. Kimberly Knackstedt today, who is joining us from the Century Foundation, and I will read her bio in just a minute. But today we are talking about the connection between domestic policy and public health and data. Lots of good conversation to come. Next slide. So this series is really linked to a course that is being run out of the Johns Hopkins Bloomberg School of Public Health in partnership with the Disability Health Research Center. I am the director of that center, and we just want to give a quick plug. If you want to learn more about our work, you can do so by going to our website, disabilityhealth.jhu.edu. Check out our podcast included, and we are on social media. We will be posting about this session as well as the upcoming session in this series on those channels. Next slide. So for today, we have some logistics. After a moderated discussion between Dr. Knackstedt and myself, there will be a Q&A session with you all in the audience. We ask that you please place your questions into the chat using the chat function. Your messages will be sent to the panelists and the moderator, which we will then read out loud on your behalf. As I indicated, we have closed captioning CART services, which are provided through Zoom or through the link that was just, again, placed in the chat. And we also have an ASL interpreter today. So thanks again to both. This session is being recorded for your awareness. If you have any technical difficulties during the course of this session, particularly in access needs, please contact Mindy at epitts4@jhmi.edu. And with that, I will introduce our speaker for today, Dr. Kim Knackstedt. I'm thrilled and honored to be kicking off this session with this conversation. So Kim Knackstedt is the director of the Disability Economic Justice Team and Collaborative, as well as a senior fellow at the Century Foundation. Her work focuses on economic justice for people with disabilities and their families. And she previously has served in disability policy positions in Congress and in the White House. She brings experience as a classroom teacher of students with disabilities and a person with chronic illness to her policy perspectives. And in 2016, Kim was the Joseph P. Kennedy Jr. Public Policy Fellow, serving on the Health, Education, Labor, and Pensions Committee, often referred to as the HELP Committee, And from 2017 to 2019, she served as the Disability Policy Advisor for Chairman Bobby Scott on the Committee on Education and Labor in the U.S. House of Representatives. From 2019 to 2021, she was the Senior Disability Policy Advisor for Senator Patty Murray, again on the Health Committee, the Health, Education, Labor, and Pensions Committee in the Senate. In January 2021, Kim was then appointed as the first Director of Disability Policy for the Domestic Policy Council under the Biden-Harris administration. It is my honor and privilege to be welcoming Dr. Knackstedt to this conversation. I really am thrilled to be having this discussion. Kim, thank you so much for taking time to join us.
I am thrilled to be here, and it's great to be talking to you. It's I've seen some collab members on the participant list, and I don't know, it feels like we could be having maybe a glass of rosé in this warm weather or something while we're having this conversation.
I love that. Yes, it's like a family meeting, right? It's all in the family.
Yes.
I think that a good way to start off this conversation is to start with some discussion about your role as the inaugural Disability Policy Advisor in the White House's Domestic Policy Council. I think that is an important conversation point because that was such a remarkable position, and you had such a great impact and continue to today. So can you share a little bit more about that role and whatever else you want to share about your time there in the White House?
Yeah, absolutely. Really, I have to say, it was an honor to take on that role and be a political appointee. I can't say, 5 years ago that was on my list of to-dos, partly because that role didn't exist, but also because I was quite happy being sort of an invisible staffer on the Hill. Being all of a sudden launched into a much more public position was not something I actually imagined taking on. But I wanted kind of go into some background about how that role sort of came to be first. So, historically, the White House had somebody in the role of the Office of Public Engagement, so the community outreach role, and that still exists today. Anna is in that role. She's doing an extraordinary job. The White House Easter egg roll just occurred, had some of the first ever accessible elements in it, really great. And so we've had that sort of outreach role for many, many years. What hadn't occurred is actually having disability policy embedded into the White House. And so when, it was candidate Biden at the time was running, he put in his disability platform that he wanted to have somebody in actually on DPC, the Domestic Policy Council, really running disability policy. And so that was new. And I think many of us weren't sure it would really happen or not when we saw that announcement. So it really I didn't have any idea that it would be me in that role. So when Ambassador Susan Rice was named, assistant to the president for domestic policy, and she got to thinking what DPC would look like, she then had to slot in where would this role of disability actually fit in, Director for Disability Policy, where would that person fit in? And so she really started to reimagine what DPC actually would look like, and not only this role, but just kind of across the board. So DPC as a whole actually looks very different than it did under the Obama administration. I'm skipping the administration in between. And so DPC it fundamentally operates a little bit differently. I'm actually going to show one slide here. I think it'll be helpful to visualize what it looks like. Here we go. Hopefully this will work. Let's see. Okay, hopefully that slide is up. So this is just a quick visual of what the Domestic Policy Council sort of looks like. So you have the Assistant to the President, Ambassador Rice, and then there's 5 different deputy assistants to the president over different roles. So we have racial justice and equity. I didn't list all of the different roles here. There's not enough room on this page. We have a deputy assistant to the president for healthcare, economy, immigration, and then we have other topics and a senior advisor. And so then under each of those are special assistants to the president and directors. So I fell under this deputy assistant to the president for racial justice and equity. And the role there really looked at, you know, how could we look at racial justice and equity, which includes disability, across sort of the entire domestic policy agenda. And so I'm gonna stop sharing here. I just wanted to give that quick visual of like, what is DPC? Because I think it's a little bit of a black box and unknown for so many people. And so we really started to look at what is DPC? What is disability policy for the White House? And what does that actually mean now? So taking on that role was not just, oh, now you're in this position and you pick up where the last administration or the former Democratic administration left off. It was actually picking up and starting an entirely new portfolio and position. It was a lot of education of, you know, every issue is a disability issue. It was a lot of trying to kind of embed myself into everything that the White House does. It was a lot of planning and thinking about events and activities. How do we bring the voice of the community into every single policy issue? And really thinking about, you know, how do we help the president and really the entire administration do the work to support every single American with a disability in all of the work that we're doing? And so it was a lot. It took on, it was a lot of work. If you think of just one person trying to do all disability policy across all domestic policy, that's a big portfolio. I also at the time oversaw the diversity, equity, inclusion, and accessibility executive order. So the implementation of that executive order. I also at one point covered the US Post Office, a little random. I also managed the long COVID portfolio in coordination with the COVID team. You know, it's when you're launching a new administration, it's sort of an all hands on deck. You do whatever is needed. And because you're trying to stand up an entire administration, not everyone's hired everywhere. So you just sort of take on whatever is dropped in your lap, good or bad. You can then add a disability lens to whatever you're working on in that role. So there's some positives to it, but it's also, it was a tremendous amount of work. I had to be a very quick learner. There's no saying, I don't know that issue. It was sort of, you take the issue on, you learn really fast, you learn how to be concise and then keep on moving forward. And then also really know where to go to for the research and know how to make evidence-based decisions very quickly. My academic hat that I could put on and then take off and move into my policy hat and then jump into my practitioner hat when I needed to. Those were really key skills that helped me, I think, be successful. And then, you know, I think one of the things I'm most proud of for that time that I was there, the 14 months that I was there, was that I really was able to bring together all the major agencies to get some key policies moving forward on disability. And there were so many people across, you know, all the federal agencies wanting to do the work and doing the work, but then we were able to come together and collaborate. And we moved major policies forward together. And a lot of that work has continued. And cross-agency policy is so underrated. And so I think just being able to do that, I felt like was such a successful moment. I'm really, really proud of it. And, you know, the long COVID guidance that came out in July 2021, movement on competitive integrated employment as well, just some major cross-agency elements that I think often go unnoticed, but are a tremendous amount of work, I think, so that I feel like were really huge wins. So that's a long way of saying it was a trip. It was really fun. It was also a tremendous amount of work.
Yeah, I mean, a tremendous amount of work. And you didn't even mention cast against the backdrop of a pandemic.
Yeah, exactly. Try not to get COVID myself. Yep.
Yeah, yeah, right, right. I mean, it's so interesting to have gotten to know you and to know all of this. And, I think what's so interesting about policy work, particularly for folks like you, is you work so hard and have such little credit, particularly in the moment, for that hard work. So I just want to give you a minute and give you so much credit and tremendous gratitude for all the work you have done and did and are still doing, because the community and the country is still feeling it. The Diversity, Equity, Inclusion, Accessibility Executive Order is a generational shift and is so important as just one example. Just tremendous impact. You said so much there about, I think, for this discussion about the linkages between domestic policy and public health. And I think a lot about how our next generation of public health professionals can get better integrated into a policy space. You talk about this cross-agency collaboration and sort of, driving forward and being a resource for evidence-based policy. I'm asking you some questions off script here based on what you said.
It's great.
From your time and your experience, for those public health trainees or even professionals out that want to get more into a policy space, what would be helpful for someone who in, those roles like you were just describing? We are honestly oftentimes so myopically focused on research, which is important, but how do we also get in the arena of driving forward good policy?
Yeah, I think, as I was saying, making evidence-based policy decisions is something that's always been so important to me. I don't know if that would always been the case, or it's because I have sort of that research background myself. But I can't imagine making a decision on policy without having pages and pages of evidence to support every single decision that's being made, right? Like that's sort of how I create a policy when I'm, when I would prepare it for the boss. I would have the resource list stacked up and ready to go, right? It's not just the memo that goes with it. It's like, here, every provision has the evidence behind it. And here are the peer-reviewed articles. Here's the reports that go into it, like the think tank reports, whatever it may be. And I don't know, I know, actually, I should start that over. I know that's not always the case. People who've heard me talk know I say this. I think so often we have solutions looking for problems in policy. Which is a problem in and of itself, right? We often start off with thinking we know the answer before we actually know the problem we're trying to drive, which means we've skipped over the evidence part. So we've lost the connection between, with the evidence driving anything. And when you start at that end point first, you lose the whole track and you end up with a policy that is really not driving in the right direction. So I think that's like a real disconnect that we have going on. But then I think on the research side, so I criticize policy, now I'll criticize the research side. Don't worry, I'll get both ends. I think sometimes in research, because I get to have one foot in each, I think sometimes we have the problem where academics like to talk to academics only. I really enjoy reading peer-reviewed journal articles, but when I left sort of the higher education fields and moved into policy, I was like, gosh, I can't afford to keep paying for all of my journal articles, all of my journals I was getting. I can't afford to keep paying to go to conferences. So I almost completely lost touch with the whole community. And then I had this awakening of, well, I'm still in the process of publishing articles. Well, now that research I was doing, by the time I finally get it published, those policy recommendations I was making are 5 years old. So how is that even relevant to actually the policy that moved in a month? And so there's this huge disconnect generally. And I think that's something that it's a problem that I don't have an answer to solve in this conundrum of, we have to figure out a way to move things a little bit faster in the research world, because we need that evidence base. We need the peer review process. but at the same time, it's moving so slowly. And then no one has access to it. So everyone's just talking to themselves. So I think there's a big problem there. I would also, and whenever I talk to doctoral students, I say this because others don't listen to me when I say it. Sometimes doctoral students do. Whenever an article is published, I so strongly recommend writing an issue brief on it, 1 page, no longer than 1 page, and send it to the Hill. Because I would say, almost 100% of the time, your policymakers are not going to read your article. You might get the one-off person that may, because they have access to it, or you sent it to them, but it's going to be too long. Nobody has time. And so if you can do 1 page that summarizes why you did the study, why it's important to relevant policy, and your recommendations, you are bridging that gap. You're kind of bridging that link. And so I think that really starts to get at like connecting the research and policy. These are, it's a bi-directional arrow. Research doesn't just drive policy. Policy also drives research. We have to connect the two. And I think we're going to continue to fall flat on both until we start to make these better connections. So, I can jump off my soapbox now, but I think that is definitely an area that I feel very strongly about.
Yeah, thanks, Kim. I fully agree. This is, and you articulated it perfectly, and I think for public health professionals in academic spaces, this is a critical issue that we need to be trained on and to think about, right? And you're right, this needs to be a better ecosystem change, because the goal of our work really is to impact the world, right? To make change. And how do we get outside of our own selves in order to actually do that? So I think that's just a critical issue.
Yeah.
Even beyond that, though, I mean, thinking about, for particularly then infusing a disability lens on top of, the things you're just describing, what do you think are the most pressing issues specifically for the disability community in that connection you were kind of describing of how research and even public health research is linked or needs to be better linked to domestic policy? Is there sort of a particular tilt or focus for the disability work that we need to be thinking about?
Yeah. I think it's hard to say if there's like one specific issue, so to speak. I think I'll put this in a couple different ways. I think like zooming way, I'll zoom out and then I'll zoom in. So zooming out, I would say the one thing that we have to look at is that, again, I said this before, every single issue we all work on is a disability issue fundamentally. Like, that is the frame. And I think until that sort of becomes just something we all embrace, we'll continue to have some of these breakdowns just generally, because disability keeps being siloed off. It keeps being something separate. It keeps being something different. And like fundamentally, everything we do is related to disability. It just is. And we have to understand that when 25% of our population are people with disabilities, and 1 in 4, right? And so I think until we really, like, as a society, sort of embrace that, and it's not just research, right? It's policy, it's everything we do. We start to really let our sink our teeth into that and just know that no matter what we're doing, we are working on disability. And that comes from like our education, right? Really teaching this, whether it's public health professionals, whether it's policy professionals, right? All of the above, really thinking about like, how is it that your work is impacting people with disabilities? How are you bringing the voice of disabled people into your work? How are you as a disabled person supported in advancing your work or even being in this work? I think that those are really the questions that we have to like think about and really move forward. So I think that's like one piece. That's kind of like the big picture piece. I think if we want to kind of zoom in a little bit, I think one of the challenges, sort of, if we're thinking about the intersection between disability policy and sort of public health, kind of digging that a little bit deeper, like you were saying, Bonnie, is like, I think traditionally, I will say health research, going a little bit broader than public health, has been and policy too, has been so rooted in more of a medical model approach. I think there's still like some resistance from the disability community at large, from like embracing public health, or embracing public health work. And so that medical model approach of, we're trying to solve your problem, we're trying to solve you, is still going to be a challenge, where the disability community at large is really in a social model form of thinking. That doesn't mean public health research and disability can't work together. It very much can, and they do, but it does mean being really conscious about the work and thinking about how the work is being approached. And so, having a social model on disability is really helping, really having the, public health researchers take a different view, making sure biases are confronted up front, making sure the voice of the participants, the disabled participants, are included from the very start, making sure that, the social context is part of the whole conversation. It's not just looking at, let's say, the chronic illness, the disease, whatever it may be, is the only thing being studied. And so I think really kind of taking a deep dive into the connections there and making sure we're moving forward together, not clashing, is going to be a piece of this that's going to be really important. And I think long COVID has offered us a lot of opportunities to do this and think about it really intentionally.
Yeah, thank you for that. I mean, I think that's such an important call to action for public health. And like you said, now is the moment to rise to that occasion of really, framing public health to be inclusive, to be centered on the disability community, and re-examining, the underpinnings of public health and why it hasn't been, right? And tackling that head on. And thinking about it, in listening to what you just said, sometimes when I think about it, I haven't made the full extension to doing that, because that actually is the best thing for policy, inside and outside of public health. And that really seems like what you're saying. So I'm going to ask you specifically about a question on data. Just listening to what you said, and I know you love data as much as I do. So
I love data.
A barrier certainly to this work is, a dearth of disability data in lots of spaces, and that has implications for the opportunities to develop good policy. I know this is something you think about. And so I'm curious to know, from your perspective, and speaking to a place of public health professionals, what would you think, what do you want to say about that? And what do you think public health can do on this issue of disability data?
Yes. Oh my gosh. I could go on for a full hour just on data. I know you could too. And especially if you really got the two of us going, we could talk about this forever. I'll try to be brief. I do love data. I specifically love an Excel sheet full of data. I just really love data. This is maybe a little known fact about me for many people that have met me more recently, but it's something I really enjoy. I think another calling is just purely a quant researcher. But yeah, I think the thing that most disappointed me when I was working at the White House and I had access to the federal agencies is, in my mind, I was like, oh, I can just ask the federal agencies for the disability data, and then I can put it together, and poof, I will have answers to all the questions I've ever wanted to know. Fun fact, that didn't happen because the data doesn't exist. And because I was like, well, maybe it's just hiding behind firewalls. And so, I can get into it now. No, that didn't happen. There's so many challenges. I'm just trying to figure out how best to start. I think one of the things that I find most frustrating is how we define disability in an inconsistent way across agencies. I'm talking federal level, just to be totally clear to all participants. I'm not even going to go into state level, but how we define disability across federal agencies, across different pieces of legislation, across however we're collecting the data, disability is defined very inconsistently, which means you cannot actually get answers to questions about how, let's say, employment policy is actually supporting people or working to know how to change it for the future. And that is a very frustrating thing. And especially when you're working on trying to think about big domestic policy questions across the board. And so that is one piece that I think is really a big challenge. The other challenge is how we disaggregate data, as in we really don't. So if you want to know how, let's say, a Black woman with a disability is doing on X thing, you cannot know that because we do not disaggregate our disability data in that way. And so that is a disservice to generally people in the United States, because we really can't dig into our data at the level we need to know how our policies are working, to know how our systems are failing people. And so that, I think, is something that really needs to change. So I think as far as like, what can public health do here? I think it's, as you're thinking about whether you're designing systems, whether you're digging into systems, whether you're collecting data, however it may be, think about the questions you're asking. Think about the data you're collecting. Think about all of the pieces. If you're setting up a whole new data system, how do you actually get at some of the questions we don't have, or how do you get the answers we don't have that we have questions about? How do you, who is the population you're really trying to target? If we don't really have a good grasp on disability across the board, how are you defining it? What's the broadest definition you can use to capture the population? If you were doing a survey, what are the questions you're asking people about disability that's going to capture the right information? And a lot of times getting input from disabled people on that is going to be a critical piece as well. And then making sure your data can be disaggregated as well. So there are a lot of steps in that process. And then I think continuing to advocate to the federal government to really think about changing some of these systems is going to be key. It's going to be a long process because some of this is in federal law. And it's going to take a long time to change, but I think also it's critically important for the future of our entire systems.
Yeah, so absolutely. And I hope public health professionals tuning in today definitely heed that, because that is exactly what's needed, right? It's going to take some momentum from inside and outside of the disability community, quite frankly, right? To make that change.
Yes.
And so I'm going to put you on the spot again, as I have this whole time. Admittedly, I've asked all off script questions, but I want to give a moment to, I know you can handle the heat. To hear you talk a little bit about your work now, and to give a minute to have you discuss, the work under the collab, because I think that has some underpinnings to what you really just described, right? Is bringing folks together and across lots of places to make change, and certainly isn't just in the wheelhouse of public health, but I think it would really be helpful to many of our folks tuning in today. So if you would indulge me in sharing a little bit about the collab.
Yeah, so we're actually coming up on our 1-year anniversary of the collab, so I am more than happy to talk about it. So the Disability Economic Justice Collaborative is actually a first of its kind initiative where we are doing something a little bit different. We're not a traditional coalition. We are truly a collaborative. The idea was, let's bring together sort of all different types of organizations, traditional disability rights and justice organizations. Let's bring together, research entities. Let's bring together public health. Let's bring together advocacy, traditional DC think tanks. We have some individuals, broader advocacy organizations that cross a variety of issue areas. We have 43 different member orgs right now, and then we have a list to add at our next membership time. But the idea was to bring everyone together and really learn from each other, learn together, and think about how do we apply a disability lens across economic policy and domestic policy. So that way, disability is thought about at the forefront of policymaking rather than as a continued afterthought and sort of a check the box. And in this sort of learning space, then everyone goes back out and continues doing the work they're doing, but with this different lens on the work. And so, we don't send letters to Congress like so many coalitions, because we're all in all those coalitions already. We all do that separately, but it's a different way of kind of doing the work together and advancing the movement. And we really center our work around kind of 5 core pillars. Policy, I'm sure that's not a shock to anyone given what we've been talking about. Research and data, also not a shock. Communications and narrative, a learning agenda, and then pipeline. And so those last 3, I'll talk a little bit more about since you've heard everything else already. Communications and narrative, we're really trying to shift away from a makers, takers, fakers narrative, where disability is seen as sort of a derogatory frame, into a very different, more positive frame about independent living, economic self-sufficiency, and again, some of those more traditional like ADA type goals, rather than that, again, makers, takers type frame. And so that's a big pillar for us of really, how do we shift that media narrative? How do we shift how disability is communicated outward? I think everyone's seen those inspiration, videos that pop up, whether it's on social media or the TV. Our learning agenda, in addition to our meetings, we have, speakers come in and help teach us about new topics, from making our work accessible to how Washington works, to appropriations, whatever it may be. Again, we're always in a learning space. I think I learn something new every time we bring somebody in, even though I'm helping organize the speakers. And then I fundamentally believe in the pipeline. Like, we cannot do the work we all want to do if we are not bringing along with us the next generation of leaders. I hope that junior staff that I work with, I hope that interns that are coming up are the people I'm working for at some point. And I think that it is so critical that we invest time in mentoring and teaching and cross collaboration, and making sure that our researchers are learning from policymakers, and our policymakers are learning from researchers, and the young folks of today get a chance to explore all of the potential opportunities, so that way we have disabled people in the halls of power in the future, more so than we have today. And so that is a big core pillar for us as well. So that's just probably longer than you wanted, but a little bit about it.
No, thank you. It's an amazing just group, and I'm grateful for your leadership in it. Clearly, you have not removed yourself from a lot of work and having a big impact, and so it is amazing. And I do hope that folks check it out. Maybe we'll put the link in the chat, because I think even for public health professionals and those in trainee spaces, it's an amazing model, really, to convene individuals, to create an innovative learning space that actually has impact. And I think that a lot of folks can learn a lot of things from it. So I just really immense gratitude for that work. It's certainly no small feat. Lots of just huge impact already. And so with that, before we turn it over to the Q&A, I want to ask one last question about the next generation, since you guys know that. What is, for public health specifically, what is your biggest hope for that next generation of public health professionals from your lens, from your perspective, knowing public health has a big impact on health and access to healthcare and lots of different dimensions that are so critical? to people with disabilities. Do you have hopes and dreams for that?
Yeah, definitely. Yeah, I would say, I mean, it's a little bit of a combination of all the things we've talked about, but I would say my biggest hope is sort of twofold. I would say one, I hope the future generation of public health professionals, have a greater intersection of disability identity and social model work in their work that they do on a daily basis. It's sort of just what they do, and it's just natural, and that includes working with disabled individuals or having their systems that empower disabled public health professionals to do the work. I think that's really important, and I hope to see more of that as we go forward. I think the second piece is really that connection between public health research and policy work that we talked about, and just having that be so natural, we don't have to talk about it anymore. I would love if, the coursework that's being done just naturally makes it happen, and it's just, it just flows and it's easy, and it's just such a part of the work that public health professionals do, and that, the policy professionals do. It's just a connection that happens. I think those two pieces together would make the future of public health so bright, and have that connection with disability policy really strong. And I think, some of that comes from all of us, teaching it. But I think it also is, I'm hoping, young folks on this call, reach out and want to do that work, and want to kind of lead the way, learn from any mistakes that we've made, and do it better than we've done in the past. But I think, the future of research and policy building off one another and being connected is just, it'd be incredible. It'd be great.
Yeah, thank you. Yeah, definitely an important additional call, I think, for us in public health to think about how we are training the next generation to have a better impact. And I know here at Hopkins, that's been a big point of discussion. And so we all shall be heeding your sage advice. So, and I think it really is important. And so with that, I want to open it up to our audience Q&A in the last 15 minutes or so. So again, if you have questions you would like to ask Dr. Knackstedt, please type them into the chat. And I see my colleague and co-instructor for this course that this seminar is attached to, Jennifer Deal, coming on. And welcome to Jennifer Deal, and my partner in this work. And I think, Dr. Deal, I think we have some questions already. Is that right?
We do. Yeah. Thank you. And thank you so much, Dr. Knackstedt. That was just really inspiring. It's wonderful. Thank you. And there was a comment in the chat from a listener who really liked the discussion about the one-page issue brief for research. And the question is just if there's other ideas for how we can disseminate research into policy.
Yeah, definitely. I think there's this idea that folks on the Hill it's like scary to approach people on the Hill. I had that impression before I worked on the Hill. I will remind everyone that people working on the Hill are people too. And so my first piece of advice is don't be afraid of sending an email. Once you get a hold of that email, that is the biggest thing. I'm sure wherever you are located at, you may have a government relations person. Find who that, if you're at a university, you have a government relations person. I will say, even I did not know that when I was in my PhD program. But there's a government relations person usually for every university. There's a government relations person oftentimes for a lot of, the places you work. So I would start there. Find out who your government relations person is and see if you can have them help you disseminate your research. Say, I would like to disseminate it. I'd like to find out which committees to send it to. I'd like to send it to members of Congress, and I would start there. If you're at, a think tank, whatever it might be, find out your government relations person there. If you're an individual, you can reach out to your specific member of Congress and send it that way. There are a lot of different options. And you know, I'm not telling you to go like lobby on issues. Remember, I'm telling you to advocate with research, just to be totally clear. I have to distinguish. But that is a good way of just like reaching out and, you know, building those relationships. People working in Congress, it's the staff you're really reaching out to. That's who's going to read your research. And again, they are everyday average people who are in jobs, and their job is to serve their constituents, serve the people of the US. And if your work is advancing the issues they're working on, then they will want to talk to you and connect with you. So use some of those pathways to help do that. Hopefully that answers that question.
Thank you. Thanks so much. There is a person in the chat is expressing some concerns that individuals who have severe disability and their families may often be excluded from these discussions and from policy decisions. And so I think the broader question is, how can we make sure that everyone is included?
I think that's a great question. I think that's a great question, especially, you know, from policy, from practice, from research. I kind of talked about all three of those. I will kind of go back to one of the points I made, that I think it's so important from the, actually, let me just say, I'm going to frame it from research and policy. I'll do both sides of those. So from research, as I said, for the researchers doing the work, it is really, really critical that you include the voice of your participants in your work. So if you, again, I mentioned I really like quant work, but I always have to remember that those numbers are people too. And I think that's where you start to lose and you start to have a disconnect. You have to remember biases that come in to the research. No matter what we're doing, there's always going to be bias. And so being able to do a check, being able to do a moment of who are the people that are in this data, how can I talk to people, adding sort of that qualitative moment of whether it's reaching out to folks and having sort of, you know, conversations, whatever it may be, to really make sure you're understanding the context, the, you know, whatever you're studying, the moment. I don't know all the specifics of what somebody might be looking at, but having that moment of sort of a check to make sure all voices are included is really, really critical, because you will hit points where you're missing something. There's just no doubt about it. That also actually goes for policy analysis research too, which is some of the work I've done on the research side. Shifting to policy, absolutely. There are very few policies that actually solve every problem for every person. And that's another reason why it's so, so important to talk to all different people that will be impacted. I think, you know, I mentioned that we have a lot of solutions looking for problems. I think when that happens, that is especially when we start to leave people out, because we start to look at the solution and forget that we're not solving something. We are trying to find a quick answer without really understanding the root of the problem. When we go back to actually finding a problem and then getting the evidence for finding a correct solution, we're able to take all the appropriate steps along the way and make sure voices are included. I'll give an example. We were working on sub-minimum wage and moving towards the introduction of the first iteration of the Transformation to Competitive Integrated Employment Act. This was a couple of years ago. This is pre-pandemic. It took us 2 years to draft that bill. The problem is people should not be paid a discriminatory wage, right? Problem. But it took a long time to find the correct solution for it. If we had just rushed through and done it, we would not have, and I actually bring that up specifically because there are a lot of people with a lot of different options and answers, and people that, you know, the whole country is a big place. So we needed to talk to all different voices in that. And so getting to the correct answer takes a long time. When you just shove an answer through, it does not always work. So I would just yes to that point from that participant. And there isn't an easy solution always to that question.
Thanks so much. I really do appreciate that perspective for thinking about ask the right question first, find the answer second. So thank you. I think we have one final question in the chat, which is, what is a disability issue you've been itching to work on that you haven't gotten to yet?
Ooh, that's a great question. I'm going to have to look who that's from, but it's funny. I'm not sure there's something that like I haven't been able to work on, to be totally honest, but I would say it's something I haven't been able to spend as much time on is probably immigration and disability. That's an area that I would really like to spend more time on, and I think is really ignored. And we have a lot of folks that do immigration policy, and we don't have a lot of folks that add a disability lens to it. And I think that's something that I have never been able to like put a lot of time and effort into. I've done a little bit on ORR, and I just would love to be able to like, I don't know, dedicate a ton of time to that. It's a really, really critical topic, and never been able to like dig all the way in as much as I need to. So that's a totally like curveball for this conversation, but
Thank
Oh,
you. That was,
Sabrina.
yeah,
Hi,
that was everything in
Sabrina.
the chat.
yeah, Serena, of course. Thanks, Serena. No, obviously that is relationships with public health. So that's great. That's great to know. We just have a few minutes left if anyone else wants to add questions to the chat. I'll just ask and take a point of privilege to ask you one more question. In that, obviously you have survived the pandemic in lots of ways, and it's hard to ignore the public health underpinnings lens of that. What do you think for the disability community for policy was one of the biggest lessons learned from, I know that's a big and perhaps overwhelming question, but again, for our next generation of public health professionals from this experience, from then adding the lens of disability, what do you think was the biggest and most important lesson to bring forward?
Yeah, it's such a good question, because like just from the question you asked though, I think it's so good, right? Because I think we tend to be like, oh, the pandemic is because it's not over. Like, just to be clear, just because the public health emergency is ending, COVID-19 virus is not going away. Just to state for everyone, the pandemic is not over. But like we only tend to look at it through like doom and gloom, because I'm one of the people that did get COVID, because most of us have gotten it at least once at this point, and it's really, really awful. But we do have to think about like the bright side moments that we can take away and the learning. And so I think from like what we can take away, this doesn't quite answer your question, but I just do want to note one of the big things. I think I guess it's kind of public health. I would say the acceleration of the mRNA vaccines is huge for those of us with chronic illnesses. And again, that doesn't like quite get to your question, but I just want to like note that generally, because I don't think it's actually talked about enough. For what it's worth for other people here, I don't respond to vaccines because I don't produce antibodies. I responded the best to like the COVID-19 vaccines, better than I've like ever responded to a vaccine, which is fascinating, right? I was in a study, I don't know, one of the many, really, really fascinating. So like the idea of the research that has come out is my point that I'm getting to. The research that has come out of the pandemic has been invaluable. Now we have to think about how can we use that with a disability lens and move that forward, and think about chronic illnesses as a whole, think about disability as a whole, and how do we improve our community for independent living as a whole. So I think there's a number of pieces there that we can like take away. I think also, there's a lot of big takeaways as far as, I don't know, how we operate in life, employment, in, different new spaces, in there's so many things of like how we operate as human beings that is going to be different as we move forward, and what that means for our health, what that means for our quality of life, And I think there's going to be so much more to come from that. I think as well, like wearing masks when you have a cold is something that I think a lot of people are going to start doing. Maybe not a lot. I think many of us that actually had a takeaway from that, and who don't want to get sick anymore. So I think there's a number of takeaways we can like really gain from it. I think also just the general, this is the largest mass disabling event any of us have ever experienced and hopefully will ever experience. What does that actually mean? And what is the impact of that is something that I think we really need to take time to dig into.
Yeah, excellent points. I think it certainly is, obviously changed the way we think about the things we do all day, every day, where we are, what we're doing, why we're doing them. And I think it is just capitalizing on that to do good.
Yeah.
Right?
Behaviors change. Like all of our behavior has changed, whether we recognize it or not.
Yeah. But as you critically underscore, doing so with the disability lens, right? So not leaving the disability community behind. Yeah. So I will give one last question before we wrap up in 2 minutes, and I'm sure you'll have to truncate your answer. We have a question about how the disability community is engaged in policy. From your tenure in DC, you indicated community engagement is so key. Any just recommendations, suggestions for our public health folks of perhaps lessons learned we can use?
Yeah. So how can they, or how is the community?
Well, I think the question is how is, but I'm sort of spinning it to then translating that to what we could use.
Yeah. Super short answer, I guess, is just, I think, the community can be engaged and is engaged in a number of different ways. So advocacy and education, I think, are key. Again, this idea that like every issue is a disability issue, I think is super important, and that it's hard to track every issue, but just being at the table, being involved. We can drop it in the chat. I know a few people have had to jump, but we've developed a framework from the collab on it's values-based, but it's disability economic justice policy framework. Just really showing that, all issues are disability issues. And fundamentally, if we focus on values, that really helps advance the idea that, disability is part of everything we do. And so that is like one big piece of it. Being at the table, a mentor of mine, somebody I really respect, always says like, be at the table, if you're at the table, you're not on the menu. And I think that's something that is really important, right? Be at the table, have the conversation, and be there to really advocate for the issues you care about. And I think, again, if you are doing research, share it. Like the vast majority of the time, somebody hasn't seen your research because, again, remember, we talk in the circles that we're based in. So be willing to share your research with others. That is going to be really, really important. That's a very quick, short answer, but I think that hits the main points.
No, thank you. And I appreciate your truncating that important response. And I thank everyone for joining us today. And really, thanks, Kim. Thanks, Dr. Knackstedt, for your time and your knowledge and all the work you have done. Again, I do understand how the unsung heroes of policy don't often get their moment. So I hope you are feeling the love for all the great things you've done and continue to do, and for sharing that with all of us. So thanks for being with us today. Thanks to Dr. Deal and the team behind the scenes running this, and to our interpreter, Jackie, and our captioner, Laura. We have another session coming with Justice Shorter on April 27th, same time, same place, 3:30 to 4:30. We're going to talk the intersection of ableism and racism and how it can impact people's lives. So tune in for that discussion. Thanks, Kim. Appreciate it.
Thank you.
Thanks, everyone.